good day to you. I am Dr. Fox, and I will be doing this nasal endoscopy on you today. Before we get started, how are you feeling? Some itchiness. And if I'm just gonna put on some gloves here for your safety and my safety, but if you when you're lying down, how does it feel? Like there's something in your throat? And do you also feel this when you're standing up or sitting up like you are right now? No. Okay. And how about coughing? Yeah. Okay, so we're gonna start by just looking down your throat with just a normal stick like this, and I'm just gonna have you say ah, and we will just have a look. I'm just gonna push down on your throat, tongue here. I mean, just say ah, just ah, just like that. Okay, so we're just looking here. Let's see. And yeah, okay. So there's nothing I can see inside your mouth, so we will be doing a nasal endoscopy. Did you get any anesthesia? Just local? Good. Okay. So it looks a bit worse. This is the microphone or the camera, and I will just be putting it inside your nostrils. I'm gonna do it in both just to see which one is gonna be the easiest to move through, and then we're gonna just insert it all the way like this and then down into your throat, so we can see like you're swallowing. We can see the inside of your throat. It might be a little bit uncomfortable in the beginning, but as soon as we're through the nose, you're not gonna feel it. Okay. So let's just start here with just looking inside here. So just looking. And then we'll look into the other nose as well. Or nostril, not nose. You don't have two noses. Maybe you do, but I'm just seeing one little nose here. Okay, so I think the first one is gonna be the best. I'm just gonna insert it here. For now, just breathe with your nose. Just in and out, just as you usually do. I'm just moving it slowly. And there we're through. Now you might feel that it's difficult breathing with your nose, so please breathe with your mouth. Okay. So, I have some tools that I'm gonna be looking at. So this is just a little screen where I can see what's happening inside here. Okay, so just gonna okay. So just let me know if there's any sort of uncomfortableness. I realize that it's not the most comfortable thing having a camera up your nose, but like if there's any region inside your throat that when I come near it you feel it's very itchy or anything, just let me know. Okay. Okay. Interesting. Well, okay. And so there's some redness inside your throat, in the area between where your esophagus and your breathing apparatus meets the wall. It's sort of a little bit inflamed, I would say. And do you eat a lot of spicy foods? Okay. Well, I can tell you the good news. There's nothing lodged inside your throat. So the feeling that you're feeling, it's not a actual physical sensation. So I think for many people, just the knowledge of knowing that there's nothing there, it helps a lot. But I can see that you're a bit inflamed. So I can just take this out now. Okay. So as I was saying, I can see that it's a bit inflamed down here in between where your breathing apparatus and your food goes down. So it's two tubes like this, and in between it there's a wall, and this wall is inflamed. That is usually a sign of like acid reflux. So that was why I was wondering about the spicy foods, also fatty foods. So I'm going to prescribe you some medicine for acid reflux, and it's very important that you keep a diary, and so that you make sure what you eat, and if you're still feeling these sensations, and if you're feeling any sort of acid reflux symptoms, so like burning in your heartburn, or like it burns in your throat, your esophagus. So just take care of these things. Just make a note, and if it's getting better, then you know that you have acid reflux, and that's the cause of your issues. If it doesn't get better, then you'll have to come back and we'll have to do another examination. That one is a little bit more invasive, I would say. So it might even require you to be put to sleep. But for now, we're gonna try this before we go to those steps, okay? So just keep a diary. Just write down what you're eating, how you're feeling. And it's very important that when you start taking this medication that you gradually decrease your dosage. So for the first 2 weeks, I would say. Actually, I can probably write this down for you. Let's see, I have a little piece of paper here. Okay, so for the first 2 weeks, to a day, so twice daily for the first 2 weeks. And then for the next 2 weeks, week 3 and 4, you do it once a day. So once a day. Once a day. And then week 5 and 6. So it's a 6 week course. You do it every other day, okay? And 6. Once every other day, I should say. Once every other day. So you take this piece of paper here, just as a note for yourself, so you don't forget. It's very important that you keep this regiment, okay? So yeah, that's about it. You can find the prescription on our website, or it will always already be with the pharmacy, so you can just go there and pick it up. We also have a pharmacy downstairs, so it's just to go down there and pick it on your way out, okay? Great. Well, are there any other questions you're having about the other procedure? Well, so in that case, we will go all the way down to your stomach. For now, we were just up here, but we will go all the way down to your stomach. It's quite a quick procedure. examination. It only takes about 3 minutes, but it's very uncomfortable, so it's not one that we like to do in the first cases, okay? So just after we've ruled out everything else, okay? But yeah, hopefully it won't come to that, okay? So take care. Make sure to write a diary. Take your medicines according to the prescriptions, and hopefully we'll beat this.